Hello, everyone. I am Joyce Wagner, Director of Revenue Cycle Management Services at AZZLY, and your moderator today. AZZLY is proud to continue offering complimentary webinars on important topics for behavioral health and addiction treatment providers. Thank you for joining us today for this webinar on prior authorizations. Prior authorizations play a crucial role in behavioral health billing by ensuring appropriate and cost-effective treatments. They help manage utilization, reduce potential fraud, and promote efficient use of resources, ultimately improving patient care and fostering a transparent and sustainable healthcare system. Our objectives around the prior authorizations today are to cover common prior authorization challenges and best practices, strategies for effective communication with payers, the impact on patient access to behavioral health care, leveraging technology to streamline prior authorizations for behavioral health care organization. If you have any questions for the panelists, please enter them through the Q&A feature on Zoom. We will have time at the end of this webinar where we will answer those questions as well as those that were sent to us prior to the webinar. We are grateful today to be joined by a very knowledgeable panel of prior authorization experts. From Hickory Recovery Network in Indiana, we are joined by Shannon Howard, Chief Reimbursement Officer, Utilization Review Management, Hickory Recovery Network. She has 25 years of healthcare revenue management, specializing in skilled nursing and residential treatment. We also have with us from Hickory, Carrie Feigert, Utilization Review Supervisor, Hickory Recovery Network. And last but not least, we have Heather Junkins, Prior Authorization Specialist from AZZLY. As an expert medical coder with 15 years of revenue cycle management RCM experience, Heather specializes in securing residential levels of care prior authorizations. We are blessed to have a panel here with so much experience. Shannon, Carrie, Heather, thank you. Now, with the introductions out of the way, let's get started. Heather, I'm going to start with you. What is the basics of a prior authorization?
Well, the basics of a prior authorization, it's a request to your payer for specific medical necessity criteria, asking them if this specific case meets what they deem to be medically necessary in order to approve the service before it's rendered. It essentially is a number that allows your patient days and times within a specific time range that they not guarantee the payment, but pre-approve the services before you render them to the patient.
Perfect. And when, Heather, is a prior authorization needed?
So a prior authorization is something that the front end team would take care of when they do an eligibility check. I recommend every time that you've got a new patient coming in, you know the specific CPT code that will be attached to the services. When they do the eligibility check, that you ask the payer if there's a prior authorization that is necessary for that specific CPT code. If you're using a portal and you are not able to find that specific information, we always recommend that you call the payer directly, document your call with call reference number, agent name, time, and date, and do it that way.
Thank you.
You're welcome.
For this question, you each specialize in a certain level of care: PHP, residential, outpatient, IOP. Could you share some of the common challenges that a UR department faces with prior authorization and the level of cares you specialize in? Carrie, can you start us out on that one?
Yeah, for PHP and detox, getting clinical in a timely fashion is a big hurdle. Sometimes it's not there. And we have to make sure we're submitting within a certain time frame. If not, we can be hit with untimely filing. Another big thing is coding, making sure the code you're using is correct on forms. When I came here from my previous position, we were paper charting there. So coming from that place to here with AZZLY, getting the documentation and having it right there is amazing. It cuts down on, like, we would have to go at my previous position, go and hunt down paper clinical. If we wanted to do an appeal, we would have to go find the whole medical chart in medical records and copy it to do that. So AZZLY cuts down on that.
Thank you very much. And Shannon, how about you for residential and IOP?
Similar to what Carrie has with PHP and detox, one of the biggest issue we have is getting the documentation timely to submit to the insurance companies. So it's really important to know what your timeline is with which specific insurance company so that you can get your paperwork submitted. It's also proactive to have a good relationship with your facilities who are doing their documentation and to educate the people who are entering information into AZZLY or into whatever system they're using to know that this has to be entered, completed, so that we can get it to the insurance company on time. That's mostly for residential. If there's certain time frames they have, so as soon as like a client signs their consent to treat, you have about 24 hours to get your initial bio treatment plans, have them seen and have that finalized in order to send to insurance companies. And insurance companies really focus on that time stamp, and if you don't have it within that 24 hours, they can ding you. IOP is a little simpler. You don't need as many requirements to begin with. Usually when you get to a continued stay review, or what we like to call a CSR, that's where the insurance companies will get more in detail looking for stuff. But it's mainly timely filing is crucial, and that's why AZZLY is so beneficial, because my entire UR team is not in the facility. We are located in the corporate office, so we can log into AZZLY and see everything that's done and when it's completed, so that we can pull it and then send to the insurance companies timely.
Okay, and Heather, how about you with residential?
Very similar to both Shannon and Carrie. It's the documentation being finalized and signed in that. For me, it's a 48-hour time window. So making sure that your clinicians and therapists are coming in and doing that work with that time frame in mind, knowing that their UMR department has to have those signed and finalized documents in order to submit for those PAs and be timely in the filing. Another would be going back and trying to make sure that you've got the correct contact information for the payers, because they are not communicative. They change their fax numbers and their payer numbers quite a bit, and they do not let us know that. So you've got to stay on top of their new forms when they're updated, as well as the contact numbers.
And can you talk a little bit about the eFax feature within AZZLY that assists with the documentation?
Yes. So the eFax feature within AZZLY, I've done this for many years. So I have, of course, been through the burden of not having that wonderful feature within other EMRs. The eFax allows you to go into the patient chart directly, pull the clinicals that you need, and fax straight from AZZLY. Even the transmission results will automatically pull into the patient chart and store in their documents tab in that chart area.
And how about the countdown feature, the authorization alert report, and the authorization referral reports? How many systems do you know that have this feature, and how has it helped?
I have never had the benefit of this feature before, so it is extremely helpful. AZZLY has a report that allows the billers to come in at any point in time and pull the authorizations that are currently being used. When you reach an 80% usage level of whatever days or units that were allotted, the auth report will notify you of this and let you know those patients that need to have concurrent reviews submitted or extension requests submitted, or if they are reaching the end of their units or days allotted and they need to have discharge clinicals sent out. It allows your biller to see all of that information and act accordingly.
Okay. Shannon, what are some best practice for avoiding challenges?
So what we do here at Hickory is we have protocols set up. We have good policy and procedures so that everybody knows when each MCO or whichever insurance company, what requirements they have and when they're due. We track all fax. AZZLY is phenomenal in that they track all faxing for us with submissions, which we've had to go back and pull to prove to an insurance company that we sent it timely. Some of the things that we do here is we want to ensure that each person who handles UR knows what codes, knows what modifiers they need to use, because if we do not, if you submit your prior authorization with the incorrect information in the beginning, it causes a delay and a lag in time frame, and it also causes some insurance companies will just automatically give you a denial where you'll have to go for a full appeal. So setting up policies and procedures, doing chart audits in your facility, making sure that your facility and your UR people have a good working relationship together. We send out daily emails sometimes. We'll pull a report from AZZLY and let the facility know what we're looking for. If something hasn't been finalized or something needs to be in the system, but timely filing is the key, is making sure that all those documentations are done on time in the chart so that we can then pull them and send them to the insurance company. So we track that and we'll let them know. Tech notes, the techs having notes in the system, making sure they're updated. That's how we avoid the issues, is just being on top of it, having auditing and great communication with your staff.
Okay, and it sounds like you have great communication with your insurance companies also.
That is key.
Do you make contacts with your insurance companies and particular individuals?
Yes, I highly recommend. So based here just in Indiana right now with our 7 RTCs we have here, we have reached out and we have figured out who our provider rep is with each insurance company. So we have a direct line to our provider rep if we have provider representative should we have any issues. Also, every insurance company has an online portal. I highly recommend signing up on their portal, getting logged in, and then every insurance company, Medicaid, MCO has a bulletin. Enlist yourself in that bulletin so that you will always have updated contact information.
Perfect. And how do prior authorizations affect patient access to behavioral health care services?
It's huge. So if we cannot obtain a prior authorization, then the client can't receive our services. So that means they'll have no behavioral health. So it's extremely critical to the clients that we are able to get the information, which is streamlined and super easy when you're using AZZLY, because everything is at your fingertips. When you log into the system, you can see all the charts. But if we're unable to obtain that authorization, then no one will be able to have behavioral health, because most insurance companies, all behavioral health requires a prior authorization, no matter who the insurance is, whether you're in or out of network.
And you just spoke before that about policy and regulatory updates and the importance of it. I think all of us that are here today can't stress enough that you need to know what the payers require, correct?
Correct.
Okay.
So since
how do you address presumptive eligibility in your state and the challenges to getting PAs for intensive residential services?
So in Indiana, Medicaid has just switched over to a new system called KeyPro. So we have aligned ourselves with them. We've reached out, found out who our provider representative is, spoke with them. PE is huge. Their KeyPro system is user-friendly. You can submit paperwork directly to them. You get authorizations back rather quickly. The challenges that we most face with the PE is a client had already applied for an MCO, and if that MCO denies them, then their PE will deny as well. Okay. But KeyPro has been it's been pretty user-friendly. A few kinks to begin with. But since the public health emergency ended, a lot of Medicaid, I've noticed in Indiana Medicaid, they're reverting back to pre-COVID guidelines and they're being a little stricter with what we're doing. So making sure that you are up to date, checking those portals daily for updates. Indiana Medicaid sends out a bulletin every Friday, and a couple of the other states that we're in right now, they have the same system. So it's just making sure that you have somebody checking those and reading to keep up to and let the staff know.
All right. Heather, having a system such as AZZLY, where the technology and automation is a benefit to behavioral healthcare organizations. Talk to us a little bit about how those mental health and substance use facilities out there should make this one of their primary concerns when deciding which software to use.
Oh my goodness. Okay, I could talk for hours about the benefit of using AZZLY and the technology and automation that comes with being a client with AZZLY. So from the front end of the pre-authorizations, it allows you to track and manage the authorizations to prove that they were there and submitted in a timely manner if that ever occurs and you need to do that. It also allows a less time for the request to get to the payer so that you can get your approval number faster and begin billing to keep your revenue cycle flowing steadily. On the back end of that, once you receive your prior authorizations and they're stored in the AZZLY patient charts, they automatically will pull into the client's claims for each claim that's submitted and start a countdown of the units or days used that are attached to the prior authorization. This is what all flows into the prior auth alert report and allows your billers to come in and make sure that everything is there that is necessary, or when they need to come in and resubmit for concurrence, like we were talking about before. So the technology and the automation that AZZLY provides for this specific part is just phenomenal. And if you don't have it in your business, you should.
And if you can talk, Shannon, a little bit, what happens if you've got to go back and renew the authorization for an extended stay? What are any challenges or benefits? What do you see when you're doing that?
So the benefits I see from AZZLY is we get an alert. We'll know when our authorizations are running low, so we'll know that we need to start prepping for that continued stay review. AZZLY has helped us being able to track all of our documentation so that when my utilization review representatives are logging into the system to see what they need, we'll see if anything hasn't been finalized or if there's any additional documentation that's needed. So it's been a huge asset to us when it comes to getting that continued stay review, because we're a 28-day treatment program. Most authorizations we get the initial 14 to 21 days. So we're going to have to do a CSR for the additional 7 days. And the medical documentation just the forms that we're able to pull and use in the facility makes it so much easier. We can just print the forms from the individual sessions or from the group sessions and then attach it to that fax and send it out to the insurance. And we have minimal denials since we've started using those features.
Thank you all for sharing your experiences. Prior authorizations play a vital role in behavioral health billing by ensuring appropriate utilization of services, controlling cost, and maintaining insurance compliance. The safeguards patients and providers facilitating access to necessary treatments while reducing the risk of claim denials and financial burdens. I'm going to go to the question and answer portion now. And I'm going to go ahead and I'm going to talk to Heather. What levels of care require prior auths?
Most levels of care that are residential, IOP, or PHP will require pre-auths in my experience. And Carrie may be able to elaborate on that as she is the expert in 2 of those areas.
Yeah, no, I definitely agree with you on that. I've only ran across a couple IOPs that do not require authorization, but it's not Medicaid payers. It would be commercial payers.
And what about your detox authorizations?
You would definitely need to get an authorization within 24 hours.
Okay.
Mm-hmm.
Can I move someone into an SUD residential program and then complete a retro prior auth if insurance coverage goes retroactive? Shannon, you want to take that one?
Yes, you can. We can apply for a retro authorization. We just have to have the correct documentation still loaded into the system. Okay.
And Carrie, if you know, does the MCOs have 15 days to respond to the pre-authorization request?
Yeah, I feel like MedWise, they are not MedWise, MHS here, they just changed to a extended time frame like that. And most of them, they could take 15 days, but most of them, besides that one payer, they'll get back to us within a couple days, not the whole 15 days.
Okay.
KeyPro has been the one that takes the longest in my experience.
Okay. And someone asked, are prior authorizations typically only needed for commercial insurances and inpatient services? Yeah, I see all of you shaking your head. So can someone, Carrie, someone speak to that?
No, with the exception of a couple commercial payers for IOP, I would say that even all commercial and MCE for Medicaid, they're gonna require prior authorization.
Okay. And someone has asked how to link AZZLY to the Georgia Collaborative Provider Connect for processing. Anybody know anything about that?
Is that for billing?
I don't know. We're going to take that one under advisement, and whoever sent that question in, we'll get back with you on that one. Okay. Let's talk a little bit about IOP practices and individual therapy. Can we talk a little bit about billing per diem and doing therapy or any other types of services on the same day? Does somebody want to take that question?
I'll start and I'll let Shannon and Carrie elaborate. So that's not normally what we would recommend. The payers like to see one or the other. And if they get the outpatient claim prior to the per diem, they're going to choose the lesser amount to pay. That's just a standard rule of thumb. We've got some providers that kind of wanted to test that out and see if it were applicable to their practice as well. And they have hit some roadblocks with that practice. Shannon, have you had any experience there?
We have. So if you have a client who's in like a 3.5 level of care, but they're also trying to do an IOP, you're not going to get paid for your 3.5 level of care because insurance company is going to take that. They can receive the services of the lower level of care. So it's not recommended to commingle your level of care. Like you can bill for a bio outside of the stay. So say if you do your bio prior to admission, you could bill for that. And then start billing your per diem the next, but it's frowned upon in the billing world. It's more like kind of a double dipping kind of a situation.
And something I will just throw in there, if you're billing two services on the same day, you probably need to have two different providers on those services rather than one, correct?
Correct. And you have to have documentation, excellent documentation as to what they are.
Okay. We had a question about a number of counseling visits that the HIT plans offer. Do they have a certain amount, or can any of you talk about that, Shannon or Carrie?
So for my IOP side, we're a 28-day program, so we're able to usually get 28 days approved for our RTC. But from our IOP standpoint, our initial auths that we've been getting 16 units, which is about 4 to 5 weeks of service for IOP. And then we'll do a continued stay review, and we'll get by that time, they're reviewing the documentation from the last 16 units to see how much they'll approve. And then it's usually like a week here or there that they'll submit it to us.
Okay. And does anybody want to talk about Optum and the requirements they have for prior auths? Challenges? Do they go through easy, or is it a headache?
We are not contracted with Anthem because it seems to be everything was an issue just in the contracting services. So I can't speak to Optum, but I've heard it's
Okay, Anthem has, especially since they went back to the non-pandemic statutes, they have become very stringent when they review the clinicals. They have even begun to ask for vitals included in the PA requests. I just had a PA come back to me last week, and the clinical nurse wanted the vitals and several other things that I have not ever seen included in the request before. They, however, are the fastest turnaround for responses with the PAs. Once they get all of the clinicals they need, within 24 to 36 hours, they've got a response back.
Okay. All right. I want to thank our whole panel today for taking the time out of your busy days and coming on here. We really appreciate it, and I'm sure our attendees do. You have more experience than most of the people I've met in my career, so I'm really pleased that you were on here today. For all of the questions that weren't answered on this, we will be getting in contact with you after the webinar. If you still have questions, please send anything to hello@AZZLY.com, and Andrew will disperse the questions and get back in touch of us. I see that Rebecca just put up a sign about contacting us about the webinar. I didn't see exactly where, but I'm sure it's at that hello@AZZLY.com. And we're going to be having our next webinar at some point in the future. So follow Eventbrite to stay up to date on our webinars. And we hope you will join us next month for our follow-up webinar. Thanks to all of you, and have a wonderful rest of your day.
Thank you, Joyce.
Thank you for having us.
Bye-bye.